Hi, so our next topic is labor and birth. In this, we have first stage of labor. So, the process of labor starts like in this. We have four sequence, right? So, first is labor. Labor, what is labor? So, basically, एक action है जिहदे विच की sequence of involuntary, like it's automatic, intermittent, it happens like on and off, uterine contractions, right? It's coordinated but it's involuntary. And the birth is the process of actual event of birth. So next we have four factors that we see during the labor process, that is power of the uterine contraction. So in this, like how forcefully, like the forces of the contraction, how good they are. Then we have effacement. Effacement is the shortening and the thinning of the cervix. And then we have dilation, that is the dilation of the cervixos, so the baby can pass through, and pushing effort by the mother. And next is the passageway. Passageway is the like the pelvis of the mother, how like a normal pelvis it looks like, right? And the tissues of the cervix, floor, and vagina. If there is any problem in the pelvis or in the cervix, in the vagina, then there will be difficulty in labor and delivery. Next we have placenta, that is the fetus, and the membranes and the placenta. So if the fetus is having some issues, then the delivery and the labor process will be difficult. Next we have the psyche, that is the psychology of the mother, like how emotional and how strong and physiological and psychological mother is during, like sometimes they have anxiety and fear which makes it hard for them to go through the process. So these are all the four P's that we assess before the patient goes through labor. For example, patient have a or the baby has some difficulty, like the brain is or the head is like in case of diabetes mellitus, there's the weight of the baby is too much, right? Then we have to change the process of the delivery, which would be like we will deliver the baby by cesarean section. So these are the factors we will see beforehand, so we can make a plan how the delivery and the labor process will go. Next we have a attitude. So attitude is the relationship of the fetal body parts to one another. So how's the parts of the baby are like when the baby is in the uterus, how the parts of the baby are aligned. Usually it's in a flexion position, like so the arms of the baby should be crossed around the chest, and the legs should be bent at the knee, then should be folded to against the body. If anything is like there is an extension, then that will lead to the larger fetal diameter and it hinders the delivery process. So the good attitude of the baby is it should be a flex position in the uterus. Next is the lie. Lie is the relationship of the fetus spine to the spine of the mother. Like is the baby lying in the longitudinal or vertical way in the uterus, or it is transverse or horizontal. If it's longitudinal, it's easier to deliver the baby, but if it's transverse or horizontal, they have to do maneuvers to bring the baby back to longitudinal lie. If it's not happening, then we cannot do like normal vaginal delivery. In that case, we have to do cesarean section, right? Next we have presentation. Presentation is the part of the fetus that enters the female pelvic inlet first, right? So basically we have cephalic, that is the head. Sometime in the head you will see the presentation part will be like a face, or it could be eyebrows, or it could be scalp, right? Then breathe sometime if the baby sputic is going through the pelvis first, then it will be, we call it breech delivery. Then shoulders, if the baby is in transverse lie, then we see the arm, back, or abdomen, like mostly at the first. So these are the presentation and presenting part. Then position helps in like assigned area of the presenting part, which part of the area is lying against the maternal pelvis, right? So if you can see on the picture on the in your book there are like a left occiput posterior, that's the position of the baby on the left side occiput part and posterior side, right? Then right occiput and then right transverse, these are the position that we have, right? Okay, so in case of the baby is lying in left occiput posterior, then it's a prolonged labor because baby has to rotate from all the way back from the sacrum to the front of the pelvis, right? That is called 1/8 rotation. But in normal, that is right occiput transverse, baby has to go only 1/3. So usually it's based on the where they locate, right? If baby is not turning, then we cannot do the normal vaginal delivery. In that case, we have to do cesarean section. So these are the basics of the labor. Next we have mechanism of labor. The first part is lightening. Lightening is also known as engagement, and it occurs when the fetus descends into pelvis about 2 weeks before the birth. And after lightening or dropping is more, once the lightening and engagement occurs, fetus cannot go back. So only one thing will happen, that mother will deliver the baby, right? Then Braxton Hicks contraction are the true labors that will increase. So how you gonna find the difference between true false labors? So true labors are regular, whereas false labors are irregular, and they are stronger and last long. True labors last long and they are stronger, but the false labor are like short duration and they don't last longer and they don't progress. And true labor leads to dilation of cervix and effacement, and the fetus engagement occurs in with the true labors in the pelvis. In the false labors, like the contractions are irregular, and as soon as the mother start walking, false labors will be going away. So this is how you can find. Usually the false labors goes away with the movement, but the true labors will increase and you will feel it more stronger and they will be lasting long. So this is the true labor and false labor difference. I don't think so there is a question comes on mechanism of labor, but you can see what happens first. First happens the engagement of the baby, like the baby fetus will go into the mother pelvis and it will reach to the ischial spine. After that, descent is the further going, like the fetus will go through the pelvis. Then the flexion, like the fetus heads will go more toward the fetal chest, and there is internal and rotation happening, because if it's nesting at the posterior side of the pelvis, it will come all the way to the front. And then extension is the coming out of the head. Then external rotation, the shoulder will rotate and then the whole body will come out, right? Then after that, next after engagement, there will be changes to the cervix and it will dilate, right? And then the labor will start. And the only thing with during the labor, you have to be careful about the rupture of the membranes, and when it happens, sometime the mother will deliver the baby right away, or sometime it takes time. So these are the processes you have to be careful.